Okay, so imagine this. You walk out to your pasture, sun's shining, everything seems, perfectly normal.
Mm-hmm.
But then you spot your horse unmoving near the edge of a pond. No obvious injuries, no sign of a struggle, just gone.
Yeah.
Or maybe your horse is suddenly staggering, drooling, then collapses. Seizures. What on earth could happen that fast?
It's a really terrifying scenario,
Yeah.
and unfortunately one that seems to be happening more often.
Right.
So today we're doing a deep dive into this hidden threat, blue-green algae, or, well, cyanobacteria, scientifically speaking.
Cyanobacteria. Okay. That sounds serious.
It is. This is just critical stuff for anyone with horses or, other livestock. The danger is very real, and it seems to be growing.
So our mission today is to really unpack this for you. We want to explore what these, well, you said they aren't really algae. Okay, what they actually are, why they're so dangerous for horses, what signs to look for, and crucially, what you can actually do to protect your animals. We've looked at a lot of veterinary toxicology sources, equine health reports, tried to pull it all together.
And here's something that often surprises people.
Yeah.
Many just see that green film on a pond and maybe some scum and think, oh, harmless pond scum.
Yeah, it just looks unpleasant, maybe.
But the truth is, these are actually bacteria, cyanobacteria. And some strains produce some of the most potent, really fast-acting toxins found anywhere in nature.
Wow.
And what's more, these blooms, these outbreaks, they're becoming much more common globally. Environmental factors are definitely playing a big role.
Okay, so let's start right there. You said the name blue-green algae is misleading. They're not algae.
That's right. It's a really key distinction to make right off the bat. They are cyanobacteria. Think of them as ancient photosynthetic bacteria.
Photosynthetic, so they use sunlight like plants.
Correct. They're tiny, single-celled factories, basically. And under certain conditions, they can start producing these highly toxic compounds, cyanotoxins.
And these cyanotoxins, that's the danger to horses if they drink the water.
Precisely. They are incredibly dangerous, often fatal, if ingested by horses, dogs, livestock, even wildlife.
And you mentioned they're becoming more common. It does feel like we hear about toxic algae alerts more often now. Why is that?
Yeah, several things are kind of converging. Warmer temperatures globally, that's definitely a factor. Warmer water helps them grow faster.
Okay.
Stagnant water, too. Ponds, slow-moving rivers, even water troughs that aren't cleaned often.
A lack of movement.
But a huge driver is nutrient runoff. Fertilizers from farms, manure from pastures. When that washes into water sources, it's like dumping fuel on a fire for these cyanobacteria.
So it feeds them, basically, leads to these huge blooms.
Exactly. These massive, rapid population explosions. That's what we call a bloom.
So if you see that green scum or the water looks like pea soup, does that automatically mean it's toxic, or is there more to it?
That is probably the single most critical point about identification. Not all blue-green algae blooms are toxic. Some strains don't produce toxins, or produce very little.
Okay, so it's not a given.
But here's the hidden danger, and it's a big one. You absolutely cannot tell if a bloom is toxic just by looking at it. It's impossible. You need lab tests.
Oh, I see.
So the safest, really the only responsible approach is to treat all blue-green algae blooms as potentially toxic. Assume the worst.
That's a clear takeaway. Assume danger if you see it. Okay.
Non-negotiable for prevention.
Got it. So moving from the source, the bloom itself, to the actual culprits, the toxins. Our sources mentioned different types, different effects. What are we dealing with?
Primarily, for horses, we're concerned with two main groups. Hepatotoxins, those target the liver, and neurotoxins, which attack the nervous system.
Liver and nerves. Okay.
There are also dermatotoxins, which cause skin irritation. But thankfully, they're less common culprits for severe illness or death.
Let's tackle the liver toxins first, the hepatotoxins. What are they doing?
The big ones are microcystins. You hear that name a lot. Also things like nodularins. And what they do is quite insidious. They target specific enzymes in liver cells, protein phosphatases, which are vital for the cell's structure and function.
So they interfere with basic cell machinery?
Exactly. They effectively cause the liver cells to just break down. It leads to severe liver cell damage, bleeding within the liver, and potentially rapid liver failure. It's a very direct assault.
That sounds horrific. How quickly would an owner see signs if a horse ingested these?
Usually clinical signs pop up within a few hours, maybe up to a day after they drink the water.
And what would those signs look like?
It can start fairly generally colic symptoms, diarrhea, which might even be bloody or black, like tar, loss of appetite. The horse might just seem really weak, lethargic, depressed.
Okay, general unwellness first.
Then you get the more liver-specific signs. Jaundice, that yellowing you see in the gums, the skin, the whites of the eyes. Pale gums, too. And if the horse survives the initial hit, they often get photosensitization.
Photosensitization, like sunburn.
Exactly. Severe sunburn-like lesions, especially on any unpigmented pink skin. It happens because the damaged liver can't process certain plant pigments properly.
Wow. And in the worst cases, if the liver damage is really severe?
In really severe cases, you can see signs of hepatic encephalopathy. That's brain dysfunction because the liver isn't filtering toxins from the blood anymore.
So the brain is affected too. What does that look like?
Disorientation, maybe aimless wandering, pressing their head against walls or fences. It can progress to seizures, even coma. And because the liver makes clotting factors, you can get bleeding problems. Ultimately, shock and organ failure.
Just devastating. Okay, so that's the liver route. What about the neurotoxins? You said they were faster.
Yeah, often much faster. We're talking about things like antitoxin. Its nickname is literally very fast death factor.
That says it all, really.
It does. There's also antitoxin EAS, saxitoxins, guanitoxin. These all mess with the nervous system, specifically how nerves talk to muscles.
How do they do that?
Well, antitoxin A, for instance, it acts like nicotine. It overstimulates the muscles, causing constant firing, then fatigue, and finally paralysis.
So tremors, then paralysis.
Pretty much. Antitoxin ES is different. It blocks the enzyme that normally breaks down a key neurotransmitter, acetylcholine. So you get massive overstimulation.
What does that cause?
It causes what vets sometimes call the SLUD signs: salivation, lacrimation, tearing, urination, defecation, dyspnea, difficulty breathing, plus muscle tremors, incoordination, convulsions because of the overstimulation.
It sounds incredibly distressing. And saxitoxins.
Saxitoxins block sodium channels in nerves, which are essential for nerve impulses. So they directly cause paralysis.
And the onset for these neurotoxins, very fast death factor, implies minutes.
Absolutely. Signs can appear within minutes to maybe an hour of drinking the water. With antitoxin AS, death can happen in as little as 30 minutes.
30 minutes.
Yeah. So the clinical signs are dramatic and rapid. Muscle tremors turning into rigidity, staggering, disorientation, excessive drooling, stumbling, paralysis, convulsions, seizures. Breathing becomes difficult. Then respiratory paralysis sets in, and that's usually the cause of death.
Which brings us back to that awful image at the start, finding a horse dead near the water with no warning.
Exactly. The stark reality, especially with the neurotoxins, is that horses are often just found dead. The progression is so incredibly fast that the owner might never see any clinical signs at all. It's over before anyone realizes there's a problem.
You also mentioned dermatotoxins briefly. Less severe.
Thankfully, yes. Much less common in terms of causing death. They typically just cause skin irritation rashes, itching, redness, maybe some blistering if there's direct skin contact with a heavy bloom. Unpleasant, but usually not life-threatening systemically.
Okay. So given the speed, the different toxin types, the non-specific early signs, diagnosis sounds incredibly difficult for vets.
It is. It's a huge challenge. Because it happens so fast, and things like colic or sudden staggering can have other causes too. Diagnosis often relies on putting pieces together, like detective work.
What are the main pieces they look for?
Number one, absolutely crucial, is the history of exposure. Has the horse been near or had access to water sources like ponds, lakes, slow rivers, even big water troughs, especially if there's visible scum or discoloration?
So connecting the environment is key.
Critical. Look for that blue-green, pea soup green, reddish-brown color, scum, foam, maybe an iridescent sheen. Has wind maybe pushed it all to one side where the horses drink? Did the sign start soon after drinking? That history is vital.
Okay, history first. Then what?
Then, of course, the clinical signs themselves. Are they neurological, the tremors, seizures, sudden death? Or are they more suggestive of liver issues, the jaundice, colic, lethargy? The specific pattern of signs gives strong clues.
And if the worst has happened, if the horse has already died?
Then a post-mortem exam, a necropsy, becomes really important. Finding dead animals, horses, maybe other livestock, even wildlife, like birds or fish near a suspect water source, is highly suggestive.
Does the necropsy show specific damage?
With neurotoxins, often not much because death was so fast. But with hepatotoxins, the liver will likely look abnormal, maybe enlarged, hemorrhagic, crumbly. Microscopic examination can show characteristic cell damage. And sometimes you can find the actual algae material in the stomach contents, or even on the horse's muzzle or legs.
And I guess lab tests are needed for definite proof.
Yes, laboratory confirmation is the gold standard. The ideal is to get a water sample from the suspected source, especially from the concentrated scum if possible. Send it to a diagnostic lab.
What can they test for?
They can identify the species of cyanobacteria present and crucially test it directly for the toxins, microcystins, anatoxin, etc. Remember, just seeing the bacteria isn't enough. You need to know if it's producing toxins.
Can you test the horse itself?
Yes. If the horse has died, testing stomach contents for toxins like microcystins can be confirmatory. Liver tissue, sometimes brain tissue too. In a live horse showing signs, blood work might show sky-high liver enzymes if hepatotoxins are involved.
What about neurotoxins and blood work?
Interestingly, with toxins like anatoxin, standard blood tests often don't show significant changes, which again highlights how specifically and rapidly they target the nervous system. Anatoxin might show depressed cholinesterase activity in the blood, which is a clue.
This all paints a picture of extreme urgency. Is there anything vets can actually do? Is there an antidote?
That's the really tough part. There is no specific antidote for any of these cyanotoxins. None.
No silver bullet then?
No. Treatment is entirely symptomatic and supportive. It's about managing the signs, supporting the horse's body systems, and trying to prevent further toxin absorption. And it has to start immediately. Time is absolutely critical.
So if you even suspect your horse drank from contaminated water, what's the very first thing to do?
Get them, and all other horses, away from that water source immediately. Provide clean, fresh water from a known safe source. Don't hesitate.
Okay, remove from source. Then what? Can you try to get the toxin out?
And this is a bit, if ingestion was very recent, like within an hour or two, and the horse is neurologically stable, not showing signs like seizures where they might inhale it,
Right, okay.
then a vet might administer activated charcoal through a stomach tube. Charcoal can bind some toxins in the gut, preventing them from being absorbed into the bloodstream.
So that's an early intervention possibility?
Yes, but only if safe to do so and under veterinary guidance. Sometimes aggressive 5E fluids or laxatives might be used too, trying to flush the system. But charcoal is the main decontamination step considered.
And beyond trying to block absorption, what supportive care is given?
Intensive care, really. Intravenous fluids are essential for hydration, circulation, supporting the kidneys. They might need dextrose added if their blood sugar crashes.
What about the liver damage?
For hepatotoxins, vets might use liver protectants, things like SAMe, Silnorin from milk thistle, B vitamins, maybe anti-inflammatories like flunixin, but very carefully because the liver is already compromised. If hepatic encephalopathy develops, specific treatments like lactulose try to reduce the brain-affecting toxins.
And for the neurological signs, the seizures, tremors?
Neurological support involves anticonvulsants like diazepam or phenobarbital for seizures. Muscle relaxants might help with severe rigidity or tremors. Respiratory support like ventilation is theoretically needed sometimes, but it's rarely practical for a horse.
Is there anything specific for that anatoxin AS when causing the SLUDD signs?
Yes, for anatoxin AS poisoning specifically, the drug atropine can counteract some of the effects. Vets might give a test dose, then repeat it until signs like excessive salivation stop.
Okay.
But atropine has its own risks in horses. It can cause severe colic, so it's used cautiously.
Okay, so it's intensive, supportive, trying to manage a cascade of problems, but no direct cure. Given all that, what is the outlook? What's the prognosis?
Honestly, the prognosis is typically guarded to grave, especially with neurotoxin exposure or severe liver damage from hepatotoxins. It is often a grim reality.
Guarded to grave. That sounds incredibly bleak.
It often is. The rapid progression we talked about means many horses die very quickly, sometimes within minutes or hours, before owners even see signs or before a vet can even get there.
So that scenario of finding them already gone is common.
Very common, particularly with neurotoxins due to that rapid respiratory paralysis. Hepatotoxins can cause acute death too, or lead to death days later from liver failure.
So even if they survive the initial crisis?
Even with immediate aggressive vet care, the chances aren't great. Survival rates can be increased, but the outcome is often poor overall.
Are there long-term effects for survivors?
Yes. Horses that survive acute liver poisoning may be left with chronic liver disease. This needs ongoing management, often impacts their quality of life, and can shorten their lifespan. And that photosensitization issue can be a persistent problem for survivors with liver damage.
This entire discussion, the difficulty of treatment, the poor prognosis, it all screams one thing. Prevention is everything.
Absolutely. That is the undeniable truth here. Prevention isn't just important. It is the most effective, most critical strategy. It's practically the only reliable way to manage this risk. It's the golden rule.
So let's focus there. What are the key practical things horse owners absolutely need to do?
The number one strategy: restrict access to suspect water sources. Fence off those ponds, lakes, slow-moving streams, especially during the warmer months, summer, early fall, and particularly after spells of hot, calm weather that encourage blooms.
Fence it off and provide clean water instead.
Always provide an alternative source, clean troughs, automatic waterers, and be cautious on trail rides too. Don't let horses drink from stagnant, murky, unknown water sources.
What about monitoring the water you do have on your property?
You need to monitor water sources regularly. Keep an eye out for those visual signs. The discoloration green, blue-green pea soup, reddish-brown, any scum, foam, or that paint-like look. Also, trust your nose. A musty, earthy, or rotten grassy smell could be a warning sign.
And if you see something suspicious,
Don't guess. Contact your local agricultural extension agent, a veterinary diagnostic lab, or your state environmental agency. Ask about water testing. Remember, you can't tell if it's toxic just by looking.
okay. We also talked about nutrient runoff feeding the blooms. Can property owners do anything about that?
Yes, definitely. Manage nutrient runoff. Minimize fertilizer uses anywhere near pastures or waterways. Make sure manure piles or runoff from animal confinement areas can't drain into ponds or streams. Planting or maintaining buffer zones, trees, shrubs, tall grasses around water bodies helps filter runoff.
Good tips. What about the water troughs themselves? Can algae grow there too?
Absolutely. Trough management is vital. Clean them regularly, especially when it's warm. Scrub them thoroughly to get rid of any slimy biofilm or visible algae.
Does shade help?
Yes, providing shade over troughs can help keep the water cooler and slow down algae growth. Some people use chemical controls like very diluted bleach or copper sulfate in troughs or ponds, but you must follow label instructions precisely.
Any cautions with those chemicals?
Yes, for example, copper sulfate is toxic to sheep, so be careful if you have mixed species. And a really important point about treating ponds with algicides: when the algae cells die, they can release a large pulse of toxins all at once.
Oh, wow. So it gets worse before it gets better.
Exactly. The water can become temporarily more toxic right after treatment.
Yeah.
So you need to restrict animal access for at least a week, maybe longer, after treating a pond.
That's a critical warning. Are there any other, maybe less obvious sources of these toxins?
One other thing to be aware of is certain supplements. Some superfood supplements for animals or even humans, like certain types of spirulina or another one called Phenoxymenon flos aquae. These are actually types of cyanobacteria.
Really? So supplements could contain toxins?
If they aren't sourced and tested properly,
Yeah.
yes, they could potentially contain cyanotoxins like microcystins. It's important to only use products from reputable companies that test rigorously and certify their products are toxin-free.
That's definitely something to keep in mind. Okay, so wrapping this up, this deep dive really underscores that blue-green algae or cyanobacteria poisoning is a serious, often incredibly fast, and potentially fatal threat.
It truly is.
And the absolute critical takeaway seems to be that prevention, managing water access, monitoring sources, controlling runoff, it isn't just the best defense, it's pretty much the only defense.
That's the long and short of it. You have to be proactive because treatment is so often too little, too late.
So maybe a final thought for everyone listening. If this potent, often invisible danger can lurk in something as ordinary as pond water, what does that tell us? What other maybe surprising environmental factors might be out there affecting our horses or even ourselves that demand more vigilance, more proactive thinking?
It's a powerful question. It really makes you think about the hidden complexities in our environment, doesn't it? How interconnected everything is, and how much we still need to learn and be aware of to protect the animals in our care and maybe even ourselves. It definitely encourages a closer look at the world around us.